Have you ever wondered if there's a way to alleviate joint pain without relying on medication or invasive procedures? Imagine a therapy that uses the power of light to help your body heal itself. Today, we delve into the fascinating world of red light therapy, a non-invasive treatment that's offering hope to many suffering from joint discomfort. At the heart of red light therapy is the concept of using specific wavelengths of light to penetrate the skin and stimulate cellular energy. This process enhances the cell's ability to repair and rejuvenate themselves. When applied to joints, red light therapy can reduce inflammation and alleviate pain, providing much needed relief. But how exactly does it work? The secret lies in the mitochondria, often referred to as the powerhouses of our cells. Red light activates these cellular engines, boosting ATP production, the energy currency of the body. With more energy, cells can function more efficiently and repair damage caused by chronic joint conditions like arthritis. Scientific studies are shedding light on the potential benefits. Research indicates that red light therapy can reduce pain and increase mobility in those with osteoarthritis by improving blood circulation and collagen production. Key factors in joint health and flexibility. What sets red light therapy apart is its non-invasiveness and low risk of side effects. Compared to traditional pain management options, it provides a gentle approach that harnesses the body's natural healing processes. As promising as it sounds, it's crucial to consult healthcare professionals to determine if this therapy suits your specific needs. In an age where we're rethinking our approaches to health, red light therapy stands as an intriguing option. By harnessing the power of light, it offers a beacon of hope for those seeking a path beyond conventional pain relief. Could this light be the answer to shining a new perspective on joint health? Only time and further research will tell.